My name is Kanari Mugume. Now, 3 health centers of Kabende, Chwamba and Kasenda Health Center 3s in Kabarole District are set to receive tricycle ambulances from the Rotary Clubs of Kabarole and Kabale to support them in improving maternal and child health. Julius Namanya updates us on healthcare situation in the area that necessitated the donation, and he will be speaking to Richard Mugahi, Assistant Commissioner, Reproductive Health, Ministry of Health. Julius, good to see you. Talk to us. How are these tricycle ambulances efficient in terms of maneuvering some of the roads in that area?
Well, thank you so much, Canary. Since they are going to operate in rural areas, they are very much important because they are going in places where the ambulances cannot reach, and this side has been with a challenge of the expecting mothers accessing health facilities. But more on this is the reason I have Richard Mugahi here with me, whom I want us to talk to explain to us more about this. You are welcome, sir. We are live on NBS.
Oh, thank you,
Julius. Talk to us. How big has been the challenge, and why should people of Toro here celebrate these tricycle ambulances?
Of course, these tricycle ambulances you can see in the background is a very important equipment, as you mentioned, for rural areas that are hard to reach, where mothers cannot easily access a means of transport to get them to the health facilities. As you know, here in Toro, we have those areas that are really very distant from the health facilities, like a place like Chwamba, Kasenda, and Kabende, where these ambulances are going to work. They are going to address the delay, a critical delay, when mothers are pregnant and have need or have an emergency that need to access the healthcare facilities. They are going to be very vital, and the unique thing about this, it's cost effective to maintain. The bigger ambulances, sometimes they cannot be maintained by the lower health facilities, but these ambulances are going to be owned by the communities, and the community should be able to maintain them, call them at any time they need them to transport them to the health facilities.
So who is taking care of them? I mean, who will be moving them to where they need them in the rural areas, and who pays for that cost?
Yeah, first of all, this is this equipment. There are quite many that we are distributing across the country, and they've been purchased with partnership of Rotary Clubs of Uganda and some Rotary International partners, also with the government of Uganda, making them tax-free, and we are able to get them into the communities. They are going to be maintained, owned by the communities. They are going to create or to have a tricycle ambulance management committee at community level, and that committee is going to take care of this equipment and be able to repair it so that it cannot be stuck at any time. The community will value them, and they will also be able to sustain them.
Okay, finally, in 30 seconds, how big has been the challenge of accessing hospital in the region? I hear there are increasing cases of death.
Yeah, correct. One of the biggest challenges we have is the delay to move from a home to the health facility. We also still have a challenge of a delay from mothers staying at home, failing to make a decision to go to the health facility, and some delay that happens also at the health facility. So this is one of the biggest delays that causes mothers to have complications or poor outcomes. And when you have equipment like this, then you are in a good position to have mothers reach the health facility early, and also the outcomes of their pregnancy being good. Thank you.
Thank you so much, Richard.
Thank you, sir.
Kanen, that's it. Nothing I can add on. It is well explained. That is the very important, very reason why these have to be celebrated for at this very time. That's it. Back to you at the Political Command Center, Kanen.
Thanks, Julius. You know, whatever is supporting the improvement of maternal health and child health should be given all the support that is required and all the attention. Thank you very much, Julius, for